Imagine this. A staggering 70% of misdiagnoses are due to cultural misunderstandings and lack of cultural competence among healthcare professionals. That is a number that should make us all pause and reflect. Our first point of focus in this training will be exploring the differences between cultural competence, cultural humility, and cultural dignity. Cultural competence involves healthcare providers possessing the knowledge, attitudes, and skills to effectively care for patients from diverse cultural backgrounds. It is not merely about being aware of cultural differences, but being able to effectively work within these differences. It's also understanding and respecting diverse health beliefs, behaviors, and needs. Cultural humility calls for ongoing self-reflection and self-critique about one's own cultural biases and prejudices. It's about recognizing that the expert in the patient's experience is the patient themselves. Cultural dignity, on the other hand, is about honoring the individuality of each patient, celebrating their unique cultural identity, and treating them with the utmost respect. Key in fostering cultural competency, humility, and dignity in healthcare practices is recognizing the importance of understanding diverse patient perspectives. Every patient brings their own sets of beliefs, values, and experiences to the healthcare encounter. Understanding these perspectives can lead to more effective communication, increased trust, and improved patient satisfaction. It can help in identifying potential health risks, improving preventative care, and ensuring that treatment plans are culturally appropriate and patient-centered. So how do we do it? How do we provide care that is culturally competent and rooted in cultural humility and dignity? Implementing the National Culturally and Linguistically Appropriate Services, or CLAS standards, is a step in that direction. They provide a blueprint for individuals and healthcare organizations to best serve the nation's increasingly diverse community. They focus on culturally competent care, language access services, and organizational supports for cultural competence. Following these standards can help reduce health disparities and improve healthcare quality. Lastly, here are some quick tips for fostering cultural sensitivity in patient interactions. By fostering cultural sensitivity, we begin building cultural competency, humility, and dignity. First, avoid making assumptions about patients based on their cultural background. Second, listen actively and empathetically to the patient's concerns and experiences. Third, use clear, simple language and check for understanding to assure effective communication. In closing, here's how you can incorporate these concepts into your practice. Start by self-reflecting on your own cultural biases and prejudices. Make an effort to learn about the cultural backgrounds of your patients. Follow the CLAS standards in your practice. And remember, every interaction with a patient is an opportunity to practice cultural sensitivity. The journey towards cultural competence is ongoing. It requires continuous learning, self-reflection, and commitment, but it's a journey worth embarking on, because at the end of the day, our goal is to provide the best possible care for all of our patients, regardless of their cultural backgrounds.